Well, good afternoon, everybody, and happy Friday, October 23, 2020, to all of you out there in SADS Facebook Live land. I'm Mike Ackerman, a genetic cardiologist at Mayo Clinic and president of the board of the SADS Foundation, the Sudden Arrhythmia Death Syndrome Foundation. So on behalf of Alice Laura, our CEO of the SADS Foundation, thanks so much for joining us. And we are still in the thick of it. We started this in February during the outbreak of SARS-CoV-2 and COVID-19 pandemic, and we're still in it. No surprise there. This is podcast or episode number 35, and so we've been together almost every Friday for the past 35 Fridays. I hope you're doing well. I know if you're like me and my family, kind of getting sick of COVID-19, but I hope you're not getting sick from COVID-19, and we can all stay coronavirus free for as long as we can. And we can do so by doing our part. Wear your mask. I wear mine every day in the clinic when I'm around people. Stay distanced. Wash your hands. Have that 60% plus alcohol and do all those things. We are worldwide, 42 million cases into it, over 8.4 million in the United States. And as you all know, almost now 225,000 deaths. We're getting better at treating COVID-19. That's good. In Mayo Clinic, our fatality rate for Mayo Clinic is less than 1%. Other places in the country and the world, not as well, almost 9%, 8% in the United Kingdom, for example. We are on now third wave of cases. This third spike is happening, so we need to buckle down and do better. There were 67,000 cases added in the United States yesterday. That's sad. That's COVID-19, but we're going to spend the rest of our time about our families with genetic heart conditions that predispose to sudden cardiac arrest. And in the month of October, we've been celebrating, or at least emphasizing, I don't think we celebrate sudden cardiac arrest, but this is National Sudden Cardiac Arrest Awareness Month. 2 weeks ago, we had the Jollies on, Anne and John Jolly, founders of SADS UK, and had a great conversation. Last Friday, you joined me with Dr. Robert Campbell, longtime member of the SADS Foundation board and key part of Project SAVE in Atlanta. And we learned a lot about that. And we're going to continue with our Sudden Cardiac Awareness Month with a very special person and a conversation with somebody who will become a fast friend of mine, I'm sure, Felicia Fischetti from Brooklyn, New York. And so Felicia is going to join us and tell us her story that makes this SADS Cardiac Arrest Awareness Month so important to her. Felicia, welcome to SADS Facebook Live.
Thank you so much. Hi, Dr. Ackerman.
Hi there. It's a treat to get to meet you and spend some time with you. And so, and as our listeners come on in, it'll be fun to welcome you, to see them come on in. Oh, I see some of you joining. So Dana's been a faithful from Ireland, and great to see you, and Summer from the UK, and Carrie from Virginia. And I know there's going to be 50 to 100 now, and no worries at all, Felicia, but there have been over 110,000 views of SADS Facebook Live since we started. So,
oh, great.
well, Felicia, you have a life-changing story, as many of our SADS families do, where everything in life was pretty good until everything dramatically changed just 2 short years ago on Labor Day in 2018. Take us back to Labor Day, Felicia, and tell us your story. And there may be, I think, Felicia disappeared on the screen for me in real time live here. So Aaron will hopefully bring Felicia back up to answer that question. In the meantime, I'll take your questions that you've started with. So, oh, there's Felicia back. So I almost was ready to take a question from our chat line. So, but 2 years ago, Labor Day 2018, Felicia, life changed for you. Fortunately, you are loved deeply by a daughter who saw you and your beloved partner and his heroic work. So tell us about that day, Felicia.
It's a pleasure to tell my story. Thank you. Labor Day night 2018, I went to bed, I fell asleep, and a miracle happened. I went into arrhythmia in my sleep, and God or an angel woke me up. I was able to get one sentence out, and I screamed to my 14-year-old daughter, Coco, that I didn't feel good. Coco called 911. She saw me slump over and called 911, and she screamed for John. John saw that I was unresponsive, and so he threw me on the floor and started to do CPR on me, which he learned 1 month before at work.
He threw you on the floor ever so gently, of course, right?
Yes.
I'm just making sure so when John watches this later tonight, everybody will know that he took great care of you with a.
He was very nervous though, so I think he really did throw me on the floor. So John started doing CPR, and in the middle of it, he screamed for my dad to come up and help. And so my dad and John proceeded to take turns doing CPR on me. So Coco went down to meet the EMS workers, and she directed them up to where I was. And the paramedics had to defibrillate me 2 times at home and 1 time in the hospital. And I'm so grateful for the persistent EMT workers and the wonderful doctors at Maimonides Hospital in Brooklyn. I was intubated. I think I was intubated. I was out of it for a whole week. I don't remember much except glimpses of my family and friends trying to cheer me up and support me. What had happened was I went into arrhythmia and then VTAC and cardiac arrest within seconds. A wonderful doctor named Dr. Guy Kolbach implanted a pacemaker and defibrillator. And thank God that he did, because this summer I had 2 more incidences and the defibrillator saved my life. So right now I'm seeing, from the beginning, I was seeing a genetic electrophysiologist, Dr. Lior Yankelson from NYU Langone. And his diagnosis is idiopathic VF.
Yeah, so you're in great hands there. So just a shout out to Dr. Jankelson. So dear, a good friend. I like him, respect him a lot. And some of the people may not know out there, Dr. Jankelson, during this COVID-19 pandemic, he and I have put out a lot of warning signs about the potential QT danger of some of the earlier COVID-19 therapies that we have basically mandated that our long QT families never receive, namely hydroxychloroquine and azithromycin. So Dr. Jankelson and I at NYU, New York University shout out, have done several things together. So I'm glad that you've been in his care. Yeah. And so he diagnoses you with idiopathic ventricular fibrillation. You get a couple shocks this last summer. Then what? What's been the latest?
So I'm on quinidine. Dr. Yankelson says this is very effective for what I have. I've had to really do some mental work, like on my mindset. I was very scared, very nervous. So I really try to focus on being grateful. I'm so grateful to be here. To my heroes, Coco, John, my dad, my mom, the EMTs, the amazing doctors at Maimonides and the Heart Rhythm Center at NYU Langone. And I'm just so grateful to tell my story.
Let me ask you, Felicia. So, I mean, for Sudden Cardiac Arrest Awareness Month, yours is one of the absolute success stories where the entire chain of survival worked. And people took great care of you, and you look fantastic. Share with some of our people. I've had many patients who are sudden cardiac arrest survivors where they and I have sort of talked about the post cardiac arrest fog, where they just haven't felt as sharp or crisp mentally, challenges, struggles, whether they're mental or emotional. What kind, have you gone through that? Did the fog lift pretty quickly for you, or did it stay? And what has been your journey like in sort of recovering the mental health and the emotional health after a close encounter with tragedy like that?
Okay, so that fog that I think you're referring to happened to me for a whole week after my first event, where I was out of it. I don't remember anything from that week. But I think I bounced back pretty quickly in terms of that. But mentally, this has been really hard. It's a struggle sometimes every day, but I just keep trying to not be stuck. You know, it was very scary in the beginning. I had a lot of anxiety and I was depressed. And I made a decision that I was going to have peace in my life and enjoy my life and just always be joyful, always pray, always give thanks in all circumstances, even the difficult ones. And it's a challenge, you know, and sometimes I have to renew this mindset like every day, every second. But I've learned that complaining or wallowing in it kind of keeps me stuck. And I'm just refusing to dwell on the negative. I try to do things for others and always be grateful. And every morning I say, thank you, God, for another day. And please show me how I could be a blessing to others.
Oh, I love that, Felicia. And when you were saying renewing your mind, I couldn't help but think of the verse in the book of Romans in the New Testament where it says, do not be conformed to the pattern of this world, but be ye transformed by the renewing of your mind. And so it just popped into my head as you were saying that. Speaking of things popping into my head, I'm curious how after your cardiac arrest in 2018, knowing that in the SADS Foundation, we see mostly genetic heart disease families like long QT syndrome or CPVT, not as much idiopathic VF like you've been diagnosed with. How did you discover the SADS Foundation?
That was through Dr. Yankelson's office and that whole team. They had given me your flyer back in 2018, and I didn't do anything with it at that point. I looked through the material, but it was really this July after the second event that I knew I needed some kind of group support. And I've been so grateful for this community, hearing people speak about, you know, things that I'm going through. And at that point, I didn't know if what had happened to me was genetic, because my grandmother, my paternal grandmother, died in her early 50s in her sleep. So at that point, we were still like figuring all of this out. Now we don't feel like it's so related. But I've been so grateful for this group, the medical experts, the advice on the mental health show that you did really helped me to find a therapist. And so I had a few sessions with a therapist, and it really helped me because I was having anxiety and I think panic attacks. And so she gave me breathing techniques that helped, really helped. And just to reframe my mindset instead of getting caught up in that continual anxiety, it helped me to stop and like reframe my thoughts.
That's fantastic. Felicia, what would you say is the most important thing that you and families like yours needs or has received from the SADS Foundation?
That's a great question. I love what you're doing every week. I love hearing from medical doctors that come up with these, brand new techniques. And I just felt like as soon as I heard you guys, I felt like I was home.
Hmm.
I loved the bingo night. I think we had like a bingo night, or it would have been the walk, which, I'm in Brooklyn. I'm very far away from you guys. So it was so great to be able to participate online. Maybe that's something that could continue even after COVID.
Yeah, and I know your story is resonating with so many, and I'm just looking over on the side, and I'll just let you know that Carrie from Delaware or Virginia, I'm sorry, is just thanking you for sharing your story, and so many are, and they've joined us from Germany. Somebody just came on, Katrin from Germany. So your story is being heard here, there, and everywhere. And as you think of the role that we all can play with Sudden Cardiac Arrest Awareness Month, you yourself teach CPR, do CPR. What can all of us be doing or should be doing to be sort of an army of first responders to react to sudden cardiac arrest?
Yeah, it's such a funny coincidence that I work at a school for the past 20 years, and for the past 15 years, I've been the CPR coordinator and arranging all the CPR classes so that every summer, all our faculty and staff could get certified. And also, for the past 10 years, I've been the point person for our AED machines at school. So I help to source them and find the right locations for them in our building to make sure that we're totally covered, like all of our spots and our sports teams and our sleepaway teams and things like that. So I would definitely say CPR, calling 911, an AED machine.
Yeah, and speaking of the AED machine, when you and I are done, we're going to be having an exciting drawing giving away an automatic external defibrillator. So don't go away, everybody. That's coming up shortly. But Felicia and I have a few things to talk about. One that I want to ask you, you mentioned your lovely daughter, Coco, 14 years old then, now 16.
Yeah.
What thoughts did you have as mom as to needing to be reassured that this is kind of your deal and your deal only right now, and not have to wonder about your daughter's well-being?
Well, we did the genetic testing, and I did come up for a gene mutation. So we had my brother and father tested. And so we just found out that that mutation is not linked to what happened to me. So that's a big relief in our family, that my brother will probably not have this, and we won't pass it down to our children. So that I'm grateful for. But just because you have something doesn't mean that you can't live and thrive with it.
Right, for sure. Last one, I'm thinking about, how a lot of people with IVF, idiopathic ventricular fibrillation, they just have their one moment, and if they're successfully resuscitated by you, they may never have another one. But in your case, you got stuck with a vivid reminder that you've got something going on here, where the defibrillator got called into action just this past summer, right? Or two
times this summer.
What did that do to you? Did that rock your world in terms of some people react to that kind of shock with, thank goodness I have my device, which is great. But others, it kind of sets them back in terms of their emotional progression and well-being, with a constant vivid reminder that the substrate is a little bit uncertain and unpredictable. Did that take a step back for you, and did you have to regain ground to kind of fly again?
Yeah, that's exactly what happened. My world was rocked after the first one. Don't get me wrong, but and I was so grateful to have the defibrillator this summer 2 times. It saved my life. But this summer was rough. I think on top of COVID and being in the house, this was hard to get through. But I think sometimes it makes you try even harder when you're going through something even harder. Like the reward is kind of even bigger. So I feel like I'm in an even better place spiritually, mentally. I'm glad you brought up a Bible scripture. That there are so many scriptures in the Bible about fear and peace and courage and bravery. These things are really helping me get through,
Yeah.
Yeah.
And Brianna has reminded me, Brianna has been with us regularly and she posted on the sidebar something that I put forward a long time ago, #refuse-to-fear. And some people scolded me about that because they said, what do you mean? Don't you fear COVID-19? And I don't. I actually don't fear. I respect it. I respect it a lot, enough to remind us all to take all the precautionary measures. But I try to embrace a view where I refuse to fear, except one thing, fear the Lord. That is the beginning of wisdom. So not to make people think I don't fear about anything. I do fear, well, maybe two things, him, the Lord, and my bride, my wife. But besides that, I #refuse to fear her. Felicia, is there anything else you would want to share with us as we are wrapping up Sudden Cardiac Arrest Awareness Month?
It's just such a pleasure to be here and to be able to tell my story to everybody. I love this group, and thank you so much.
And if we're ever in Brooklyn, and I did get your name right, Felicia Fischetti.
Yes.
Maybe you don't know, but Italian cuisine is probably my favorite. In our Italian restaurant here in Rochester, Victoria's, the Marco Polo is my absolute most favorite dish of all time. What say you as your favorite Italian cuisine that I should consider when I'm out there, if I get a fly out there again? When, not if, when. We'll get through this. When I get a fly out there again.
When you come to Brooklyn, you're going to come to our house. John and I are amazing cooks, and we're going to cook something. We're going to cook you a home-cooked Italian meal. It'll be fabulous.
Oh my! I hope this pandemic ends real soon then, because I'm already salivating. So, on behalf of SADS Foundation, Felicia, thanks for sharing your story. It's just a treat. You are amazing. All of our survivors are, but I think your story has resonated either now live or it will with those who will watch it later. So thanks a lot, Felicia. I look forward to seeing you.
Thank you.
Speaking of, earlier we mentioned the AED, the automatic external defibrillator that was part of saving Felicia's life. And I just want to thank the company One Beat CPR. That's One Beat CPR, and a representative that we've been working with from One Beat CPR for a long time from that company, Jeff Patak. And to do that, we're going to have Jan Schiller. She's the director of development for us at the SADS Foundation. Jan's going to join me in a moment as Aaron brings her up, as in right now. And so, Jan Schiller, we have a live drawing for an automatic external defibrillator that has been generously donated to us from One Beat CPR, a company based out of Florida. So, Jan, I'm going to let you say what you want to say and then do the drawing. Aaron, there you go, Jan. You were muted, so now you're good.
All right, thank you, Erin. She has the power. I would like to thank everyone who entered into our opportunity drawing for this AED, as well as a couple of backpacks, and definitely thank One Beat CPR. We have made $1,665, which as all of you know, goes to us supporting our families and supporting medical education of healthcare professionals so that they accurately diagnose and refer all of our SADS families to the right people. So first off, the winner of the AED is, drumroll, Erin Clark. So congratulations, Erin. One Beat CPR, I will give them your name and address, and they will be mailing it to you. Instead of them mailing it to us and us mailing it to you, it'll come directly from them. And then we have 2 red backpacks. We had started this promotion during school. So we wanted to give away some backpacks. So there's a notepad, and there's a few school supplies. And then there is a ton of SAD swag. There's bracelets and socks and a mask and a headband and all sorts of fun things that will be sent your way in this great big red backpack. And the winners of the backpacks are Kristen and Kyle Weldon. And so we will be sending a backpack to you, and also Courtney Moore. And so a backpack will get sent to you with the school supplies and the SAD swag. And once again, thanks One Beat CPR, and thank everybody who purchased a ticket. It allows us to keep supporting SADS families, and it's been taking place of some of our fundraising events that haven't been able to take place this year. So thank you so much.
Thanks, Jan. And speaking of fundraising events, I mean, to all of our listeners live now and later, you know, if you have access to wealth, or you're one note away from it, or whatever means, large and small, if you were inclined, on our website, www.stopsads.org, there's a button on the top right corner called Donate, and it's really easy. You can also reach out to Jan and connect her with a potential philanthropist, benefactor, giver, somebody who wants to join the SADS Foundation in our mission to have families at risk of sudden death live and thrive despite their diagnosis. So Jan, I'm right, aren't I, that it's really easy to give and it's really easy to reach you?
Yeah, my email is, like everybody on staff, is our first name @sads.org. So jan@sads.org, give me an email and I will be happy to visit with you and to work on continuing to support the SADS Foundation so we can support our families.
That's great. Jan, thanks so much for doing this. And One Beat CPR and Jeff Peacock, thank you. And so we have a few minutes. I'm only going to take about 5 minutes or so because several questions have come along the line. I think some of Felicia's comments of how she navigated her journey from Labor Day 2018 till now, some themes have emerged. Carrie shares with us about her 16-year-old son being diagnosed with CPVT. We talked about that condition, being very well treated, and is grateful that we're talking about the anxiety component because it's a very real and a struggle every day. Carrie is asking about advice for a child to get through anxiety. Kayla is asking about being gripped by anxiety after surviving sudden cardiac arrest, having a genetic result, learning that her newborn is positive for that genetic result, and now rocking her mental health world. And so I want to take a little time to address all of these questions. And I think the first is to acknowledge that I think pediatric cardiologists and adult cardiologists in general, we have not done a good job with recognizing and addressing and acknowledging the tremendous emotional health disruption that genetic heart disease can bring and that a sudden cardiac arrest survivor experiences. And just to acknowledge that it's real, that it's not weakness, that, and importantly, that once acknowledged as real and not because of your intrinsic weakness, we can overcome this. We will overcome this. I see so many families that were riddled in anxiety, crippled by it, and then are free. So wherever you are in your anxiety, You will fly again. We will figure it out together, whether it's the SADS Foundation, whether it's a tag team with your local healthcare team, whether it's you as the nuclear family figuring out with your child what is the sort of the seeds of that anxiety. Is it fear of a future shock? Is it being bullied at school because they're now different? Is it that they just got kicked out of their sport that they loved and they're not coping well because of that, and maybe being disqualified isn't the only option available to your son or daughter? Is it for Kayla a sense of guilt that we as a parent pass something on to our child? By the way, you had no say in that. And for Kayla and her precious newborn, we're going to be fine. Your child will be fine. You will be fine. Your ship will be righted. And it's not surprising that your world got rocked a bit. News like that rocks many families' worlds. So I think just accept that the anxiety is not ridiculous to have, that it's not weakness on your part or frailty, or if you were only stronger, but to also acknowledge that this is going to be temporary and that it's not acceptable to stay anxious for a long term of time. It's not healthy or helpful to anybody. And as you size up, where are you in your anxiety journey? If it is not decreasing, then you have the wrong team assembled. Because with the right team assembled and the right kind of attention given, I promise, I guarantee, the anxiety will get less and less. It might come back like it did for Felicia when she was reminded about her heart with her life-saving ICD shocks this past summer. But then you get back on the horse and you go again. And before you know it, you mount up with wings as eagles. And you run and you're not weary, and you walk and you don't faint. And so refuse to fear. Get help if you get a sense that Johnny, Sally, whoever is not coping in this. Be aware that it's not surprising to have it right at new diagnoses or new changes or new disruptions. Spend some time trying to unpack what's the source of that anxiety so that we can really address that. There's nothing like knowledge. Knowledge is power, and there's nothing like knowing that when we diagnose your condition correctly, when we establish a good treatment program, we almost always get to enable you to do everything and anything that you love to do. So lots of things to look forward to and be optimistic about and to be encouraged by. And I hope this serves as some encouragement to you. This does remind me that this was such an important issue that we've actually pre-scheduled doing round 2 on that mental health one. I think it's one of the Fridays in December. I don't have my calendar on me to double check that, but we have it scheduled, and we will be doing sort of mental health exercises and being very willing to talk about anxiety and the challenges that you have. So this has been a great day. Next week, I hope you join us again. I think you're going to enjoy the program a lot. And as we wrap up October, in 5 days, look, Jaden turns 9 months old in 5 days. So that's a sneak peek of her 9-month-old picture, my granddaughter, Jaden. So on behalf of the SADS Foundation, thanks for choosing to spend these 40 minutes with us. And I just, again, want to thank so much Felicia Fischetti from Brooklyn, New York. I can't wait to have that Italian dinner. And also to thank Jeff Peacock and One Beat CPR for donating the AED, the automatic external defibrillator. And thanks and congrats to the winner. Until then, and next week, stay well, stay safe, stay corona free, and refuse to fear. Take care, everyone. See you next week.